This video will cover how to provide effective CPR on farm using this basic kit, as well as a flowchart showing the steps to follow, and if you don't have a resuscitation pump, an alternative is an ambu bag such as this one. The pump works with a central portion which moves in and out. To assemble it, attach the wide end which forms the suction pump, and then the other end is the face mask which will be used to provide breaths to the patient. This end is placed over the patient's face to give breaths, while the other end, with the yellow attachment, is the suction end which is used to clear the airway. Wearing gloves, clear the airway of fluid by either using your hand as shown here or by using the mask on the suction pump to clear the airways. Once the airway is clear, vigorous towel drying will help to stimulate the animal to move and breathe. In most cases, this will be all you need to ensure the animal is able to sit up and breathe unaided. If the animal does not begin to move rapidly after birth, check for a heartbeat. If the heartbeat is slow or absent, you need to start to provide breaths. Place the pump over the animal's nostrils and give one breath every 3 to 6 seconds, but no faster. Meanwhile, have somebody else call the vet. You can use an ambu bag instead of the pump to give breaths in a similar manner and at the same slow rate of one breath every 3 to 6 seconds. You can also use the rhythm guide on the Foal CPCR app. If the heartbeat is absent or very slow or faint, start chest compressions. Press with the palms of your hands on the highest point of the ribs, keeping your elbows locked. This is quite tiring, so swap with a colleague every few minutes if possible. Stop and check for a pulse and signs of life at least once every minute, then continue giving breaths and compressions. You can stop compressions once the pulse returns and then stop breaths once the animal is breathing on its own, then monitor carefully for any signs of further complications. If there is no response after 20 minutes and the eye is fixed and dilated, CPR has been unsuccessful. Do not give rapid breaths. This will reduce the outflow of blood from the heart and may actually damage the lungs. Press on the highest point to the ribs rather than directly over the heart. Make sure to keep your elbows locked as you give compressions, otherwise it's very tiring and not very effective. Use your body weight as shown here to keep your elbows locked. Okay, see the practical class for more details on how to perform effective CPR.